Welcome back guys. Now in this video let's discuss about the concepts of the preload and afterload. What exactly is preload and afterload means? See, we have already discussed about the preload. You already know about the preload. Preload is nothing but what? End-diastolic volume. So preload is nothing but end-diastolic volume. And how much is the end-diastolic volume? You know, 120 ml. Okay, the amount of blood that you are going to keep in the ventricle before the contraction, that's called as the end-diastolic volume. It's 120 ml. Preload is nothing but the volume of blood. And what exactly is afterload, sir? That we will discuss now. Okay. So look at this diagram, guys. This is the right side of the heart, you know, right ventricle, and here is the left ventricle. Now you tell me how much blood I am keeping here. Say the amount of blood that I am keeping here, okay, in the ventricle before the contraction. The amount of blood that I am keeping in the ventricle can be considered as a preload. How much blood you are keeping is a preload, and it depends on what? It depends on the venous return. If more venous blood, see these are all the veins. Veins are the place where your blood is stored. Most of the blood is stored in the veins. Today, what happened to your veins? Let's say the veins are constricted. Okay, the veins are constricted. Now, what will happen when the vein is getting constricted? It will push the blood towards the heart. When the veins are constricted, when they are squeezed, imagine just like a balloon being squeezed, or a water bottle getting squeezed. What will happen? The blood will be pushed up. Okay, so now the blood will be pushed towards the heart. Means more venous return. Whenever there is more venous returning of the blood, more the heart will fill, more will be the preload. Now tell me where this blood will go. Now this blood will go to the lungs for the purpose of oxygenation, and the blood will be oxygenated, and now the blood will become arterial blood, and now the same arterial blood is going to come here, and here the left ventricle is also going to be getting filled more. So more the venous return, more will be the filling, more will be the preload, or more will be the end-diastolic volume. So finally the statement is the preload is dependent on what? Venous return. You keep more blood, heart have to work more. That's why I'm calling it as a load. Okay, imagine a donkey like having the weights. The more weight you keep, the more the donkey has to work. Okay, now that's why this is considered as a load. You keep more blood in the heart. Heart has to use more energy. Heart has to use more oxygen. Heart has to use more ATP for pushing the blood. Okay, pushing the blood forward. So tell me, preload depends on what? Preload depends on venous return. Okay. Now let's see how the venous return changes. Changes in venous return. Let's talk about a drug called as epinephrine. Okay, epinephrine. You know, epinephrine is a venoconstrictor. Okay, it's a venoconstrictor. Means it's going to cause a squeezing of the veins or constriction of the veins. You tell me whenever there is a venoconstriction, there is going to be increased venous return. Whenever venous return increases, there is going to be increased preload. Okay, preload increases. So yeah, so whenever the venous return changes, the preload automatically changes. Now let me talk about a drug called as nitrates. Nitrates, we all know they are venodilators. Okay, nitrates are the venodilators. And you tell me whenever the veins are getting dilated, see imagine these veins are getting dilated, what will happen? The blood is going to pull down because of the gravity. Most of the blood will be pulled down into the veins. So venoconstriction increases the venous return. Venodilation is going to cause a pulling of the blood in the veins. So there is going to be decreased venous return. Whenever venous return decreases, there is going to be decreased preload. Okay, done. So this is how the preload will change based on the venous return. Next, let's say the person is doing inspiration. How preload changes? See, whenever a person is taking a deep breath, let's say deep inspiration, what will happen? The thoracic volume increases. The thoracic volume increases. There is going to be a negative intrathoracic pressure. There is going to be development of the negative intrathoracic pressure over here. Now, whenever there is negative intrathoracic pressure, this negative pressure is going to be acting like a vacuum. This negative pressure is going to suck the blood towards the heart. It's going to pull the blood towards the heart. Means more blood is going towards the heart. More venous blood is going to the heart. So, inspiration increases venous return, in turn increases preload. Okay, increases the preload. Next, when a person is going from standing to lying down position, okay, standing to lying down position. So what do you think will happen? Standing to lying down position. Imagine a person is standing like this. Okay, imagine this is like a person. Okay, here is the head and here will be the heart. Okay. Now, when a person is going from standing position to lying down position, what will happen? When a person is standing, most of the blood is gravitated down in his lower limbs. Because of the gravity, most of the blood is pulled down into the veins. But imagine when a person is going from a standing position to lying down position, what will happen? Now the blood is equally distributed. Now more venous blood is going towards the heart. Okay. So when a person goes from standing to lying down position, more venous blood will start to go towards the heart. So there is increase venous return, increase preload. So that is the reason why the heart failure patients, the patients who are having valvular abnormalities, or the patient who is having congestive heart failure, okay. So whenever they go from a standing position to lying down position, okay, more venous blood will go to the heart, more preload on the heart. That's the reason why they are having the failing heart. They could not able to take this much amount of the preload. So immediately they are going to have the problems like dyspnea, all these problems will come. Okay, always remember, going from a standing position to lying down position increases the venous return to the heart, increases the load on the heart, increases the work done by the heart. Their heart cannot able to do that. Okay, their heart is already weak heart. It's not getting proper amount of oxygen. So if you give a lot of load, it cannot work. That is the reason why there will be development of the back pressures that can lead to the dyspnea. Okay, so these are the conditions. Like, just I am giving you examples where the venous return will change, and whenever the venous return changes, automatically the preload of the heart will change. Okay. Now, after this, let's discuss about the topic of afterload. So, what exactly is afterload, sir, and what afterload depends on? Okay, afterload depends on which parameters? For that, you need to draw this diagram with me. Here is a left ventricle, and from the left ventricle, here is the aorta. Okay, there is aorta, and aorta is going to divide into arteries. Arteries are further divided into arterioles. Okay, left ventricle, aorta, arteries, and arterioles. Okay, now this is how the vascular system is. This is how generally the vascular system is, we know. Now, tell me what is this valve that I am showing here? This is the aortic valve. Okay. Now, how to understand the afterload, sir? You tell me what is the function of the heart. The function of the heart is like in a pump. It's just a pump in our body. It's trying to push the blood. Okay, it's creating the pressure. It's trying to push the blood into the circulation. So the blood is moving. Okay, the blood is moving. So it's delivering the oxygen to the tissues, nutrient to the tissues. Like, it's collecting the waste products. Yeah. So what I'm trying to say, if heart is a pump, definitely it has to produce some pressure in order to push the blood. In order to push the blood into the circulation, it has to generate a pressure. How much pressure? We know during systole, heart will generate a pressure of 120 mmHg. Okay. So now this 120 mmHg pressure is called as afterload. Now you understand what is afterload? Afterload is a pressure. Preload is a volume. Preload is a volume. Means amount of blood you are keeping in the heart. Afterload is a pressure. Okay. So the amount of pressure required by the left ventricle in order to push the blood into the circulation. Okay. So now 120 mmHg. Preload is 120 ml. But afterload is 120 mmHg. Now, one more important point that I forgot to teach you here, arterioles, they contains a lot of smooth muscles around them. Okay, arterioles are the blood vessels which contains a maximum amount of smooth muscles around them. Okay, they are having lots and lots of smooth muscles. Okay, lot of vasculature, it's a lot of smooth muscle is there here around them. So they can undergo constriction as well as a dilation. Now, let's say this afterload, this 120 mmHg pressure is dependent on what? It depends on what? Let's say today, he is a healthy individual, so the blood with 120 mmHg pressure, normally the blood is being pushed into the entire vasculature, entire circulation. That's fine. Today what happened? Let's say my person's arterioles are constricted because of this, like, the muscle contraction, the arterioles are constricted. Now tell me, when the blood vessels are constricted, what happened to the resistance for the flow of blood? What happened to the resistance? Now there is more resistance. Okay, now because the blood vessels are constricted, they are squeezed, they are offering more resistance, they are giving more impedance for the flow of blood. Okay, so now tell me, what heart has to do? In order to push the blood, now heart has to generate not 120 mmHg, now it has to generate a pressure of, let's say, 150 mmHg. Now it has to generate pressure of more afterload is required. So now tell me, afterload is dependent on what? The pressure, is it 120 or 150 or 200? It is dependent on the vessels, vascular resistance, whether the vessels are constricted or whether the vessels are dilated. If the vessels are in dilated state, it is very easy for the heart to push the blood. If the vessels are constricted in state, it is very hard for the heart to push the blood. So afterload is dependent on vascular resistance. Okay. Preload is dependent on venous return, afterload is dependent on vascular resistance. Okay. So that is the reason why here afterload depends on what? Total peripheral vascular resistance, resistance of all the blood vessels together. Okay. And total peripheral resistance is maximum with which blood vessels offer more maximum resistance or more resistance? The answer is arterioles. And you know the reason why? Because arterioles has a maximum smooth muscle, so they will undergo severe vasoconstriction, they can lead to maximum resistance. Okay. So that's it. So the preload and afterload are the two loads on the heart. Okay. So who will decide how much work the heart has to do? One is the preload, the amount of blood that you are keeping in the heart. The more the blood you keep, the more the heart has to work. And if there is more resistance, the heart has to push with more energy. The heart has to put with more pressure. For that, it has to use more oxygen, more ATP. So how much a heart has to work is dependent on two things. One is how much blood you are putting in the heart, and other one is the vascular resistance. More the vascular resistance, more the energy it has to do, more the work it has to do. Okay. So now how this is important for me as a doctor? Okay, if you ask how this is important for me as a doctor, imagine today you are dealing with a heart failure patient. Okay, you are dealing with heart failure patient. Okay, congestive heart failure, CHF. So tell me, he is having a failing heart. So tell me, if a person is having a failing heart, you have to increase the workload on the heart or you have to decrease the load on the heart? You have to decrease the load. So you have to decrease workload on the heart. So how many loads do you know? You know preload and afterload. So now you tell me, you have to decrease the preload, means you keep less blood in the heart. You just keep less blood in the heart, so it can push easily. It can push the blood easily. So how to decrease the preload? By giving venodilators. So venodilators are going to decrease the preload, and you can also decrease the afterload. Okay, you can also decrease the afterload. How to decrease the afterload? By giving the arteriolodilators. You just give a drug called as arteriolodilator or a hydralazine, which is the arteriolodilator. You give hydralazine, immediately arterioles will be dilated. So what happened to the vascular resistance? Decreases. So afterload automatically decreases. So afterload, to decrease afterload, you have to use arteriolodilators. Okay. So this is how. Okay, you have to understand the concept of preload and afterload, which are the two things which will determine the work done by the heart. Okay. So with this, the concept of preload and afterload is completed. Hope the video is helpful. Thank you.